My name is Ojina, and my background is in medicine, public health, and human nutrition. And I am here so we can share some few tips in general health that will enable you have a more vibrant, energetic, and healthful life. And I am not here to teach you medicine. I know that's a process that takes so many years. I'm only here to give you an overview of what we can do in order to become healthy. And just before I begin, I need you to follow Harambee Sacco in all social media pages, and then subscribe also to our channels so that you help us pass the message across to a great number of people. My first question to you is, how would you like it if you worked all the years of your life, 30, 40 years, only to retire into sickness? Because this is what happens. Many times we become so preoccupied with work, pressures of life, pressures of family, to the point where we ignore our health. And this is a tragedy, because all the money that we make in all the years that we spend working, we end up not enjoying it, and we give it all to the doctors and to the hospitals. I have especially one scenario where my uncle was a financial director of a very big pharmaceutical institution in Nairobi. And when he retired at his prime age, he got a very, very hefty pay in terms of pension, I believe. And it was in millions of shillings. But this is the thing, 3 months down the line, he was diagnosed with a problem in the heart. And he had to run to India, come back. They could not help him. He had to run to all the best hospitals in the country. They could not help him. And finally, they told him that there would be help if he went to the US. So he took a flight to the US, and then he realized that the total cost of treatment for that heart ailment would take the entire sum of money that he was paid on retirement. And he had to choose between life and the money. And he lost all the money during that treatment session in order to live. But he didn't live for so long. We lost him a few months later. This is the exact scenario that happens to most people, especially professionals. They ignore the small daily habits that could make them healthy, and then end up regretting why they had to work too hard at the expense of their own health. We had a writer, his name is Robin Sharma, who once wrote a book. And the book says, "Who will cry when you die?" And the question is, who will really cry when you die? It is said that just about 2, 3, 4, sometimes 5 people would cry when you die. And probably your spouse is not even one of them. For the sake of the people who will cry when you die, you need to take care of your health. You need to take care of your health. I'm not sure you're aware that we have 50 million people in this country today. And out of these 50 million people, probably it is important you understand that just about 10 million or under make it to the age of 50. About 10 million or less make it to the age of 50. And even though roughly 10 million make it to the age of 50. So what I mean by that is that, it's very, very fortunate to live to be 50. Then just about 2 million people make it to the age of 60. just about 2 million people, slightly under 2 million people, make it to the age of 60. What that means is that you can't just take it for granted that you're going to be here. It means you have to be deliberate with your health. You have to be very, very deliberate and know exactly and have a plan for how your health is going to be when you finally come of age. We are not talking about how many people get to the age of 70, because we know the lifespan of people in this country is generally just about or less than 60 years. That's the general lifespan of the people in this country. And so we have very, very few people who actually make it to the age of 70. It is said that roughly 97.64% of people really don't make it past the age of 67. That is a very, very small number. And did you know that just about 0.02% of people in this country make it to the age of 100? How does that add up? Now, for a population of, say, 12,000 people, we expect only one person to make it to the age of 100. So it is like, if we talk of Operation Age 100, now 12,000 people are in a race running. Are you going to be ahead of all of them and make it to the ripe age of 100, or are you going to be among the people who do not make it to the age of 100? I think the goal should be to make it to the age of 100, and not just the age of 100, to make it to the age of 100 when you're still healthy, strong, and happy, and not make it to the age of 100 when you're suffering, struggling, you have a lot of pain, and you are in hospital throughout your last years on earth. That happens only when you put in place the small day-to-day habits that would generally keep you healthy. It is said that generally recent research and statistics shows that just about 3 to 5% of the entire population are healthy people. 3 to 5%. What does that add up to be? That adds up to be anywhere between 3 people to 5 people out of every 100 people. That means that even as we are in this webinar today, take the total number, round up that percentage, get 3 to 5% of all the audience in this group, and that is the number of people who are metabolically healthy. That's the number of people who we expect would get to age 50, 60 without being on any prescription drug. And I have to tell you that it doesn't happen by accident. It is generally somebody has to be consistent, has to be committed, and has to be deliberate, in making sure that they become among the 3 to 5% of persons who are metabolically healthy. So in the world today, we have numerous health problems that we face. And some of these health problems are non-communicable diseases. In other words, to say non-communicable, it means you cannot get it from another person. Once you are diseased, it is yours. No other person can share that disease with you. And then we have communicable diseases which are passed from one person to another. And there are many. On the other side, we have diseases that are genetically predisposed. In other words, you are born with the wrong gene that predisposes you to a certain kind of illness. But at the same time, we have diseases that are born out of environmental toxins. For example, you are inhaling certain substances that have the potential to cause disease, eating certain foods that have the risk of causing disease, or drinking water which have the potential to cause disease in your body. We call them environmental. So environmental pollutants can also cause lots of illnesses in the world. But when we talk about non-communicable diseases, so here we have problems like hypertension, high blood pressure. Once I was in Nyeri town, and I had to meet with the Minister for Health, and he told me that 80% of every adult 50 and above who comes to the office to talk of any reason is having both high blood pressure and diabetes. That's a huge number. Comfortably speaking, the world over we have close to 1 billion people suffering from high blood pressure. So this is not an uncommon problem. This is a huge problem. And it's worse when we know that this huge problem is caused by factors which generally are modifiable, or in other words, easy to avoid. Diabetes, for example, affects close to 750 million people globally. Is a huge health burden in the whole world, and so far it's also a very, very huge health burden in this part of the world. The other day, just about 2 weeks ago, we had a kidney day, where the world was, recognizing, the World Kidney Disease Day. And we heard that about 5 million people in Kenya have, as young as 3 years, in cancers, okay, in this part of the world. In cancers, okay, in this part of the world. Generally speaking, the word to be sick, you've heard of people saying, I am sick. To be sick is to wake up and feel like something is off. Something is off with your body. To wake up and feel like I don't feel myself. Maybe you feel nauseated a bit, or fatigued, or malaced. You have some feeling that you believe is not normal. You get generally so tired, weak, and you can't understand how that is happening. We say you are sick, because now when you are sick, you may now have to seek some help. So you may have to go to the hospital, and in the hospital, they may run some tests and then do what is called a diagnosis. And therefore, the diagnosis means they want to identify what is making you feel sick. So now the hospital, they can end up saying, fine, we realize what is making you feel sick is a disease called diabetes type 2. Or we realize what is making you feel sick is a cancer of this nature. You have a diagnosis now. And once you have a diagnosis, that diagnosis now becomes a disease. So now you separate the word being sick from the word disease. Now you're not just sick, you are now deceased. You have a disease, okay? And the disease may now be treated, but the disease can progress. We call that prognosis in medicine. It may progress despite treatment, or it may slow down, but it is a disease for that matter. If things don't work the way it should, you may end up becoming unable to do your day-to-day activities the way you did before. So it's kind of, you become paralyzed. You become unable to perform the way you were performing before. Now, when that happens, now we have a different word for it, which is generally subjective. And we say you are now ill. So you are ill because the disease has made it difficult for you to perform your normal day-to-day functions that you did earlier before you became sick, you diagnosed with the disease, and therefore you become ill, so you are not functioning fully the way you should have functioned. So that's really the big difference between the word disease, the word illness, and sickness. And for us today, we want to focus on disease slightly before we touch the issue of sickness and illness. Now, How can you tell that you are not in the proper state of health? First of all, there are basic things that you can just tell by studying your own life. You may not have received any diagnosis and you may not have felt sick at all. But if you can't get sufficient sleep, you have trouble falling asleep. If you notice that you never wake up to deliberately do some form of exercise, if you discover that you have voracious appetite for foods which are not considered healthy, or you simply lack appetite for that matter, or you're feeling generally weak, a kind of feeling that you never have on day-to-day basis, we can begin to say that you are already showing signs of sickness, and those signs require a diagnosis so we can know which disease that you're suffering from. And so you'll notice that many times what brings you to hospital is the fact that you feel differently from how your body feels on a day-to-day basis, or what you call normal. Many times people don't know that by the time you feel like that, the disease has been progressing for quite a period of time. And so when you notice malaise, you notice fatigueness, you notice nausea, you feel some pain, you have some discomfort in your stomach, you feel pain in the back, on the legs, headache, okay, you are bloating, or you have flatulence in your digestive system, for that matter, or you're generally just weak. You are sweating, you are lacking sleep. Sometimes you begin to develop breathing difficulty, or some pain as you breathe, or you have some cough, or you notice that certain eruptions are beginning to occur on your skin, which was otherwise smooth before, or there is some kind of swelling that is coming up which is either painful or not painful. It is important to understand that when these things happen, you already having a problem that needs to be checked up. Because diseases, as we know them, are caused by very, very simple factors. And the simple factors may be as simple as, not breathing properly, not being able to breathe properly. Very few people know how to breathe properly. It could be as simple as not knowing how to match your food. We have adults who know how to match clothes, but they don't know how to match their meals. They don't even know which meal is a protein, which meal is a carbohydrate, which meal is a fat, and how should they be combined to give optimal health to one individual. The people just eat because the food is delicious and they want to fill up the tummy. It could be caused by as simple as you exposing yourself to pollutants. You expose yourself to an environment that is polluted. And that can be as simple as you're doing your jogging or walks along the major highways where vehicles are moving around and releasing exhausts that you are all the time inhaling. It could be as simple as, in your home, you don't treat your water, or you consume water that is not filtered, or generally speaking, even bottled water for that matter. We know a number of, water bottling plants use, very, very poor quality plastic bottles, and they contain a chemical called, BPA, which is very, very dangerous and cancer-causing. But even if you leave that, we have what is called, microplastic leach that comes from these water bottles. It is not very safe taking water from these bottles the way we know them. And we have all these companies all over, selling bottles. Besides, most of these waters, whenever they are analyzed, it is discovered that they contain a number of microorganisms that infect us. Okay, a number of live microorganisms, and which include bacteria, fungi, viruses, and parasites, which get into our bodies and give us trouble. So disease could come from as simple as drinking water. It could come from as simple as the kind of cooking style that they use in your home, the type of cooking oil that they use, in the home. But generally your favorite meal that you eat on a day-to-day basis for a longer period of time may have certain effect that will finally lead to disease. Disease can come about just as a result of having poor sleeping patterns. They say the best time to fall asleep is before midnight. So if you can fall asleep 1-2 hours earlier than midnight, you do better than the person who falls asleep after midnight. But if that continues for a prolonged period of time, there is risk that it will destabilize, your system in ways that can be scientifically explained and lead to disease. Disease can come about just because you are leading a sedentary life. Sedentary meaning you are not exercising. That one of you just sleep, wake up, get into your car, park, get into the elevator, go to the office, sit down the entire day, go out again, jump into the car, go back home, maybe take an elevator to the house, get into the house, sit down, watch TV, and then go to bed. That is sedentary lifestyle, and it is more lethal even than smoking cigarettes. So that can be an area of disease. Disease may come about because you are exposing yourself to persons who are unwell. All right, given there's nothing wrong going to hospitals to see sick people, but sometimes you are the one who may take disease to somebody who is already sick. Chances are in hospitals, the health workers in hospitals know how to take precaution against disease, but you as a lay person going to hospital, you need to get some tips on how best to behave yourself when you're in an hospital environment, because it is possible to pick very, very bad infections in a hospital setup. So all these things can cause diseases. Of course, some of these factors which cause diseases are modifiable. In other words, you can work to change them. But some of these factors which cause disease are not modifiable. For example, aging. If you are aging, that is an unmodifiable risk. Actually, the first risk of disease is aging. Anybody who has gone beyond the age of 35 has begun to develop risk of disease that is related to aging, for that matter. So you can do nothing about that. You can do nothing about your genes. So if your parents gave birth to you with a gene that predisposes you to a certain kind of illness, again, there's very little you can do about it. But other factors are modifiable. In other words, you can decide to change certain aspects, certain habits of your lifestyle, and you get better. And why not do that? Because disease is a very, very painful thing. It's a very expensive thing. It's draining to the family, and it's even to your children. Think about them. I just told you about Robin Sharma and the book Who Will Cry When You Die. They are going to feel the pain and burden of having to take care of you. And so if it is related to factors which are avoidable, the most important thing is to find out, how can I help myself avoid this kind of disease that is ravaging the society? I just told you, 5 million people in Kenya are suffering kidney disease. That's a huge number. But a huge number of people are suffering cancers in this country. A huge number of people, 1 out of every 4 people, has some form of mental disorder. The mental disease is big. They're suffering depression, they're suffering anxiety, they're suffering schizophrenia, they're suffering Parkinson, they're suffering a host of, psychotic problems, both at home and in the workplace. And these are normal people. Whenever we see them, we think they're normal, they're nicely dressed, they talk to us as if everything is okay, but these people are suffering mental disorders. And sometimes, these mental disorders emanate from certain physiological aspects caused by disease in certain parts of the body, and then the biochemistry changes, and that information is passed to the brain, and then mental confusion begins. All the same, there are things which put you at risk. So being overweight will put you at risk. Leading a sedentary life will put you at risk. Eating a poor diet will put you at risk. Avoiding to separate, personal time with work time can put you at risk. But having, improper social life, okay, that can put you at risk too. By the way, if you do not have social connections, again, that could be, one area that can put you at risk of disease. Of course, again, we mentioned, if you're not having maybe regular medical checkups and you're not discussing stuff with your healthcare provider, you'll definitely get at risk. Those who, believe in self-medication and, they purchase drugs and consume on their own because they think they've Googled one or two things about health. And this is very, very common, that people feel some pain, some discomfort, and they run to the internet, to Google, to see what their disease or what their symptom could be showing in terms of their health, and which kind of medication they may need to take. And then they just walk to the chemist and tell the pharmacist to give them a certain kind. I think that is very, very risky to do. And I don't think the government or the world, for that matter, would be very stupid to keep or train a doctor for 7 years in college. If at all, getting information about a disease was as easy as just Googling out and coming out with an answer. 90% of people write health articles in the internet have no medical background. And likewise, 90% of the sites that talk about health and what you need to do in order to become healthy, again, do not come from medical backgrounds or from medical institutions. And therefore, it is a big risk to try to, Google your life, your health online, and then convince yourself that you've now come up with a solution. We see this a lot in our practice. We see it most of the time. People come in and they already know what their disease is, and they know what procedure they need, what medication they need, and they tell you they need this kind of treatment and this kind of drug because, there's nothing wrong in trying to know and understand your disease. But I think the reason you go to the doctor is because you want to get their opinion in relation to what you're feeling. And their opinion is more important than generally just you running out. Because you might be feeling headache, but headache could be related to a number of things. You might be having abdominal pain, and then sometimes internet tells you this abdominal pain is because of appendicitis. The truth is, the other medical professional will try to find out where the pain is coming from and what type of pain it is and what triggers it and how long it has been there. And from there, they'll be able to find out or to think out what your problem is much better than the way you would have imagined based on the kind of information you just picked online. So it's important to, get to the hospital and, get a proper diagnosis done whenever you feel that your health is not optimal the way it should be. But that is just one aspect of it. I personally think that you need to be keeping in touch with your healthcare provider regularly in order to be able to tell whether or not your health is headed to the right direction. Why is that important? That is important because there are quite a number of health problems, especially the most dangerous ones, which have no symptoms and have no warning. And therefore, when the year begins, it is very, very important to go check with your healthcare provider what kind of tests they need to run in order to give you a certificate of good health, for that matter. And not like a paper certificate. We talk about certificate, meaning I think you are on the right direction in relation to your health. So they'll check your blood pressure, they check your blood sugar, they check, do pulmonary function tests to see how your lungs are functioning. They can put you on a stress test to see how your heart responds to exercise. Maybe use an echocardiogram, to see how the heart is pumping, or put you on a contrast to what we call angiography to see how circulation is taking place in your body. You need to have a test for your kidneys. We call it a kidney function test to check the electrolyte balance in your kidneys to see if there is any leakage of proteins or leakage of blood or leakage of sugar from your kidney into your urine. But above all, they need to check what is called the EGFR, which generally determines the amount of creatinine, is a special type of substance that the kidney, excretes. And if the levels are so high, it just means that your kidneys are probably not functioning optimally the way they should function. So you could use that to get the information. On the other hand, generally speaking, you need to have a lab check to see the levels of your cholesterols. It's called a lipid panel test or lipid profile test. So that way, the doctor would be able to see if the type of fats in your body are taking a dangerous direction, or you are in optimal. If you are a man, a male for that matter, you may need to do a PSA test, meaning to check your prostate. For women, it may be important to do the HPV test. So you do a pap smear, also do a mammogram that will detect if there is anything that is going wrong with your body before it happens. Do a diabetes test. We have a test called the HB1AC test, which can give us a general idea on how insulin is behaving in your body. You may check uric acid, so we can see if your joints are going to be affected or not. All these tests are very, very important, and they are diagnostic for that matter. You need to have them. On the other hand, once you have these tests carried out, including cancer screening, it may be important to now discuss with your healthcare provider which healthcare procedure that you people need to follow through. And there are many options of treatment when a disease is diagnosed in your body. For example, your doctor may recommend medications, and there are different types of medications. Now, each and every disease has its own set of medications. Pain medications are there, and anti-inflammatory medications. There are medications for hypertension, there are medications to manage your sugar levels, there are medications to manage your blood cholesterols. There are medications for your mind, mental health. there are medications for energy. There are medications that can take care of all aspects of your health, and up to and including surgical therapies. The thing is, not all diseases are curable. That's very, very important for you to know. But even though diseases are not curable, they can be managed. We call that treatment. So there's a difference between the word treating disease and curing disease. To cure is to root it out totally and completely. And treatment meaning, giving you medication to either help you cope or to reduce the effect or to stop its progress. All those still fall under treatment, and then it has to go with a follow-up also. All these kinds of management techniques are very, very important. You got to know that some diseases will be managed for many years, others for a few weeks, others for a few months, before you finally feel better or get results. But most importantly, you need to be on the road of being treated in order to be able to get well. But I personally would recommend that as an individual, you take responsibility for your health. Your doctor is not responsible for your health. Yes, your spouse is not responsible for your health. Your children are not responsible for your health. Your doctor is just your consultant. You have to take full responsibility. Know what you put in your body as food. Know what you inhale. Know what you drink. Find out if you are sedentary or not sedentary. How is your sleep? Are you in touch with a healthcare provider that guides you on the health tips and habits that you need to develop in order to maintain good health? So understand what a good diet is. And it really doesn't matter, like we don't have to, push you to a certain area of diet, say we need you to go vegetarian, or we need you to be vegan, or you become paleo, or do Atkins, or do carnivore diet for that matter, or become ketogenic. The kind of diet that you want to do will depend on how you weighed your body, but very, very important, with discussion with your healthcare provider. I personally feel that understanding where your disease, the root cause of your disease comes from, and tackling it is more important than running to the hospital because you have a good medical cover and you have money and you can pay the doctors and pay the hospital, wait for a disease to be diagnosed, and then we begin to pump drugs in your body or do surgeries. You will never go back to where you are. Every time you use medicine, each and every drug that you consume has a range of effects. Each drug has a host of side effects. And the moment you finish any dosage of medication, your body will never go back to where it was before. That is not right. So try to fight the disease naturally at your individual level, because when you finally get sick today, the pain, the people who know you will not share the pain with you. The people you do not want, the people you're running to go and serve, those that are stopping you from doing exercise, will come to the hospital to see you soon. And there's nothing, they will not share your pain. All they'll say is, you will get well, even if they think you won't get well. So take stock of everything that you do on day-to-day basis. And ask yourself that, am I on track? Many years ago as a student in the US, we worked in some restaurant and washing plates, and then we would get promotion to become temporary cashiers. And there was something they used to call cashing out. And cashing out was a very difficult thing because at the end of the day, you had to balance the receipts with the orders, with the money, to see if it is balancing. And if it wasn't balancing, you'd be kept there even beyond midnight, just trying to do the cashing out thing. And so at the end of the day, what you needed to do was to make sure that every time an order comes, you receive the money, you have your own book, you mark everything, to make sure that by the time cashing in time comes, you are updated. This is what you need to do with your health. okay? Do cashing in. Take stock every day, sit down and ask yourself, have I done things that are in line with keeping with good health? That is very, very important to remember. And before I go into, because I may need to find out if you have any questions that you may want me to answer, I think it's important for me to say that when we come to healthcare, the future is big. There is a lot of research that is going on. For example, AI, you've heard of the word AI, and AI simply means artificial intelligence. So we have AI methods of diagnosing disease that the world is adopting. Stem cell technology and stem cell therapy has become big. So we know managing disease and detecting disease will become much easier as time goes by. Genetic editing, diagnosing your genes to identify which gene in your body is responsible for what kind of illness. These are still developments which are coming in the future. We still have, again, something we call nanotechnology, okay, which has the potential to be able to identify or be used to get directly to the place of the health discomfort. Robotic surgeries are also being developed, so it will be possible, in fact, to do surgeries without the invasive nature of the old school nature of surgeries. There is what we call precision medicine that is also being adopted, where scientists and medics will be able to formulate medication specifically for you as an individual to help you get well. So the future is big in relation to that. And with that, I think I will take a few questions. I can see a number of questions on my desk, and I would like to maybe just take a look at the ones that I have not covered. But I think you need to know that I've covered quite a number of them. The first person is asking, what is a TSH test? This generally is a thyroid function test, and we are able to tell the levels of the thyroid hormones, whether they are low or high, and that would indicate whether or not you're going to develop hormonal imbalance in your body. And it's a very, very important test, especially for persons who are of age, adults. Can sugar levels become normal, or you will stay in medication forever? You don't have to stay in medication forever. The good news is it is possible to have your sugar levels become normal by changing your lifestyle. We do lifestyle management, but I think it is important to work with a healthcare provider in order to know what is right for you and what is not right for you. We have seen people whose sugar levels have actually come back to normal. And it's not just about having the sugar being normal. It's about taming the behavior of your insulin hormone. Because if you did eat today, your sugar levels will just drop. And that does not mean your sugar levels will not jump up tomorrow if you ate sugary foods, okay? Do you recommend plastic surgery that is now trending? It's a very nice question. I think, yes, there are recommendations where plastic surgery would work ideally. And I see it is trending. For example, I was just reading a certain article where it says we have about 150,000 medical tourists that leave this country to seek medical attention outside the country. And 80% of them are not sick people. So what are they going out to do? They're going for these cosmetic surgeries. It has its benefit, medically speaking. If you are deformed and we need to get you back to shape, those are areas where we think it is useful. But persons who are doing it for beauty purposes, I think that's a different thing. That's a personal decision, personal opinion. And I think even insurance does not cater for that kind of thing. What is your comment on SHA, and what alternatives can you advise our members? I would probably have no comment on something like SHA. I don't understand very well the issues or the politics around it, but I think there are bodies that are directly connected with this, and I suggest such a person get information directly from the SHA authorities. What makes your heart to enlarge, and what is the treatment? The heart can enlarge for a number of reasons. You can have an infection. The heart can enlarge because you're obese. The heart can enlarge because you're sedentary. The heart can enlarge because you're not doing exercise. The heart can enlarge because you're accumulating a lot of visceral fat. The heart can enlarge because of trauma and injury. The heart can enlarge for a number of reasons, and when it enlarges, it becomes weak. It doesn't pump blood properly, and with that, now we say you have a heart failure, and there are a number of treatments, and we have specialists for that in the country. Mental health. Mental health is a big issue, and the amount of time we have here cannot allow us to go that. I only want you to know that in this country, 1 in 4 people suffer mental health problems. Is huge, is in organizations, is in schools, is in families, and it's important that we are able to tell who has a mental problem and then be able to understand how they can be supported and how they can be helped. Which food can help one reduce weight? I think you can discuss this with your healthcare provider. All foods are good for you. I think you need to be able to calculate the amount of calories that your body requires and then not go beyond that. But I generally think that if you stop taking a lot of excess amount of processed foods and refined carbohydrates and sugars, chances are your body can cope with the other types of foods, and also to make sure that you're putting the right fats in your body. Yes, so somebody is asking what type of vaccinations or wellness or screening tests one recommends. These are various, and I've just mentioned a number of them. I think vaccinations are very, very important, especially if you are at risk of certain kind of vaccinatable illnesses. If you are elderly, things like flu shot may be good for you. If you're young, probably not so much. There are areas where you'll need vaccine against typhoid, against TB. I think today vaccine against things like hepatitis may be very, very useful to you. Vaccination against these young girls, HPV, to reduce the risk of getting cervical cancers in future may be important. But these vaccinations, the various, and the type of vaccine that you need to take will depend on your individual situation, circumstances, age, and health status. All those should determine. The current trends of healthy men just collapsing here and there, what is your take? They are healthy, they just die the next day. Is it because of vaccination? I don't think it is because of vaccination, but there's something we notice. There's a disease, there's something called calcification, where we have calcium deposits forming within our blood vessels. This is a serious condition. And I always do recommend a kind of test called the coronary artery score, calcium score, where you are able to detect the amount of calcium deposits in your bloodstream. What happens is that when that happens, blockage takes place. That can lead to a number of issues. And so your pressure will rise, obviously. That will affect your kidneys, affect your heart, and might even lead to things like stroke. And many people who just collapse and die have very, very high levels in coronary calcium score in their blood arteries. I think one of the things that we found to be useful is if you can consume foods that are rich in vitamin K2. And they are rare, they are only fermented. Generally, vitamin K2 does not ordinarily come from the foods you eat, like vitamin K, K1. So you could consider taking vitamin K2 as a supplement, especially mixed with D3, because it helps remove the calcium salts from the bloodstream and takes them to the bones. So you can improve the quality and density of your bones and leave your blood capillaries to become clean. So we cannot discuss everything online. You could pick my contacts from the host of today's meeting. And I just hope that you benefited a great deal from our presentation this afternoon. Should you have any further questions or need any consultations, I am always available. The management can help you know how to reach me, and I will be able to advise you whenever I can or refer you to the right place if it is appropriate. So thank you very much. Go ahead and subscribe to our channel and share this information as widely as possible and stay healthy. Thank you.